So firstly, we'll be starting active movement at the elbow. We'll be starting with flexion. So I'll be asking my client to bring the hand to their shoulder, and this will involve muscles such as the bicep brachii, the brachiodialis and the pronator teres. And then for extension, ask them to bring their arms back down, which will involve the tricep brachii. Next, we're moving on to active pronation and supination. So for pronation, I'll be asking them to bring their hands down towards the floor, and supination up towards the ceiling. Now we'll be doing passive range of motion at the elbow, so I will be bringing that arm into flexion, activating muscles such as the bicep brachii, the pronator teres, the brachialis, making sure to ask for any pain. And then when bringing them into extension, it will be activating muscles such as the triceps brachii, making sure to look for that quality of movement. Now for passive supination and pronation, I will just hold their hand as if I'm shaking it and moving it towards the floor and towards the ceiling. Now we're doing resisted range of movement for flexion and extension. So I'll just, with one hand, stabilise the shoulder, and the other start them extended and ask them to bring their hand up to their shoulder while resisting. And then for extension, hold the back of their wrist and ask them to push back. And then again, hold them in a shaking hand-like position, start them in supination and ask them to go around to pronation, and the opposing way. For wrist flexion, I will start by asking them to start with their fingers palms flat and then bring their fingers towards themselves, and then extension, flip their hands over and bring them towards themselves again. And then for radial deviation, I'll ask them to bring their thumbs in towards each other, and ulnar deviation, bring their pinkies away from each other. Passively, I will do this by one hand on the base of their wrist and bring their fingers up towards themselves, flip their hands over and do the same for extension. And then ulnar deviation, I will have their hands flat and put my hand on the inside of their wrist towards their thumb and push outwards. And for radial deviation, my hand on the outer part of their hand and push inwards, making sure for any pain this could cause. Now moving on to restricted movement, I will place my hand on top of his fingers and ask for him to bring his hands up towards himself, with him matching the force that I apply. And again, doing that on both hands, starting with the non-injured side and then working to the injured side. For extension, I'll be doing the same and asking him to bring his fingers up towards himself, asking again any pain this may cause. And then for ulnar radiation, hold the outside of his hands and push while he pushes outwards and I push inwards, and vice versa for radial. Lastly, for the functional test for the elbow and the hand and wrist, we will be doing a press up against a wall. I'm just explaining how to place the hands on the wall, slowly lower yourself down, almost to your nose touching the wall, and then press back up. And then I've asked my client to do that. I'll be watching the movement and assessing the quality, seeing if there's any compensation or any pain that this may cause.